Across Canada, seniors of color face unique and complex challenges that shape their daily lives and long-term well-being. These issues are not isolated. They often overlap, creating cumulative disadvantages that can be difficult to overcome. Today, we are exploring 10 key issues affecting racialized older adults in Canada, including immigrants, and why understanding these challenges is crucial for building a more equitable society. Economic insecurity is a significant concern for seniors of color. Older racialized women, in particular, experience the highest rates of low income and poverty among older Canadians. In 2020, 18.6% of older racialized women lived in low income and 9.1% lived in poverty, according to Statistics Canada. Additionally, older immigrants face income gaps of up to 50% compared with Canadian-born older adults, highlighting persistent financial disparities. Housing insecurity and inadequate living conditions are pressing issues for older immigrants and racialized seniors. They are at greater risk of homelessness or precarious housing situations. Mainstream supportive living facilities often lack culturally appropriate accommodations, such as language support, dietary options, and respect for religious practices. This lack of cultural competency can make it difficult for seniors of color to feel at home or receive the care they need. Accessing health and home care supports can be especially challenging for racialized immigrant older adults. Many report difficulties navigating the healthcare system due to language barriers, cultural differences, and structural inequalities. These challenges often result in worse health outcomes, including poorer self-rated health and more functional limitations compared to non-racialized older adults. The healthcare system must address these barriers to ensure equitable care for all seniors. Social isolation and loneliness disproportionately affect older immigrants and racialized seniors. Factors such as language barriers, weak social networks, separation from family and friends, and experiences of discrimination all contribute to this isolation. Government reports note that immigrant and refugee seniors are more likely to live in poverty, have poorer health, and face access challenges, which further compound their risk of social isolation and loneliness. Chronic health conditions are more prevalent among racialized immigrant older adults in Canada. Research shows that these seniors have higher rates of chronic illnesses, worse self-rated health, and greater disability or functional limitations than their non-racialized peers. Furthermore, perceived health tends to decline more sharply with age in racialized groups, according to Statistics Canada, underscoring the need for targeted health interventions. Mental health access inequities are another serious concern. Older racialized immigrants face compounded barriers in using mental health care due to the intersection of race, migration, and old age. Language and cultural isolation can intensify feelings of loneliness, which is a known risk factor for poor mental health. Addressing these barriers requires culturally sensitive mental health services and outreach. Food insecurity is a significant issue for racialized adults in Canada. For example, Black adults experience food insecurity rates nearly 2.8 times higher than white adults. While this data is not exclusive to seniors, it signals heightened risks for older racialized adults who may already face economic and health challenges that limit their access to nutritious food. In supportive living or long-term care settings, older racialized and ethno-cultural minority residents often find that mainstream homes lack culturally appropriate food, religious services, and staff who speak their language. This cultural mismatch can reduce both the quality of life and the quality of care for seniors of color. Seniors of color face multiple, overlapping forms of discrimination, including ageism, racism, and challenges related to immigration and language. Research highlights the importance of recognizing how these factors intersect to shape disadvantage and exclusion for racialized older adults. Despite their significant contributions through unpaid caregiving, volunteerism, and community engagement, older immigrant and racialized seniors are often overlooked in policy discussions. Their specific needs and experiences remain under-recognized, underscoring the need for more inclusive and intersectional policy approaches.